Hello everyone. I'm going to start the recordings now for our third ticket to class, and these are going to be all about cancer drugs, how they relate to the cancer cell, and how much cell kill that each of them have, along with we need to talk about statistics that are going on. So here we go. And here it is. I just looked it up. We're always about 2 years behind. Last year I was reporting 2014, and American Cancer Society, a great place to always go to for any question of any cancer. They help a lot of people, and they give a lot of great information. It's their life. A lot of people, this is their whole life's work is tied up with the American Cancer Society. So anyway, as of 2015, as you can see, 8 million people, they're saying, are now dying from cancer annually. It is just going up. The Center for Disease Control and Prevention, they state that 14 million are diagnosed now with cancer every year. And again, that statistic is going up. It's not just that we have more people on the planet. It's that we don't have a lot of healthy lifestyles. Some of us think we have a very healthy lifestyle, but we don't. And, you've heard me say it before. We need to learn the information, and then we need to disseminate it out there. That's our job as a healthcare provider. Educate, educate, educate. So anyway, and as you can see, I should have bolded it. 1/3 of the cases are preventable. And that is why we have to do our part. Women ages, the prime of their life, 30 to 74, neoplastic, again, get used to that word, that means cancer. Diseases lead all other causes of mortality. Most common cancers are the breast, lung, colorectal. Among children ages 1 to 14, cancer is the leading cause of non-accidental death. We know that children, the leading cause of death are accidents because they're all over the place and sometimes unsupervised. But there you go. Other than that, cancer. Among men, most common cancers are prostate, lung, colorectal, and then you can just read the numbers as well as I can. But you can see what leads it to this day is lung and bronchus. Again, no smoking. Nobody wants to breathe in secondhand smoke. The vaping is a nightmare. Stop the vaping. We need to get rid of that too. Okay. So what is cancer? It refers to a group of disorders, not just a single disease. It's so many different systems and different types of cells, whether they're metastatic and benign, and we're going to talk about that too during the lecture, are umbrellaed under this. So very, very different. It's a huge group of disorders. Various forms of cancer differ in their phenotype and aggressiveness. Do they lie dormant, or are they super active to the point where we can hardly catch them? And they all do differ in response to drugs. And these drugs, if you're diagnosed with cancer today, you're going to be treated with a different type of cancer regimen than you will in 2019. It's that quick. The FDA has definitely, as we talked about, I think the first week of school, they have produced laws to that effect so that we can help these people. We can't look at these drugs for several years. They change very quickly. Okay, so what is it? We used to think that cancer was very uncontrolled and rapid, and some of it still is. But they don't think that way so much anymore. They say it's definitely uncontrolled because the nature of a cancer cell, why isn't it replicating like we want it to, like it is supposed to? It's misbehaving. But what they say that not all cancers proliferate or grow and rapidly produce rapidly. The correct explanation for the relentless growth of tumors per Lenny, and that's our author in our farm book, is malignant cells are unresponsive to the feedback mechanisms that regulate normal cellular proliferation in healthy tissue. So I'll say that again. Malignant cells are unresponsive to the feedback mechanisms in our body to keep it normal that regulate cellular proliferation in healthy tissue. So cancer cells are able to continue multiplying under conditions that would suppress further growth and division of normal cells. Cancer treatment. We have many different types. Surgery, usually used for treatment for solid tumors with markers that they can just go in and grab. Radiation, of course, is going to be through some type of an X-ray. And then drug therapy, 4 major classes: cytotoxic versus non-cytotoxic, hormones and hormone antagonists, immunomodulators, and targeted drugs. So cytotoxic drugs are drugs that kill cell directly. It kind of says it, toxic cyto. It kills it, just goes in and kills it. Hormones and hormone antagonists are just what they are. They're hormones that the body usually makes, and hormones antagonists that don't allow hormones to work, especially if we find out that we have an estrogen based tumor. Well, we don't want to feed it estrogen. We want to stop that estrogen, and that's where we would have a hormone antagonist. And immunomodulators are biologic response modifiers, and we're going to go into that a little bit further, all of these further. Let's see. Targeted drugs are drugs that bind with specific molecules that promote cancer cells. So they're targeted. They bind with specific molecules. Drug therapies used for disseminated cancers such as leukemias, disseminated lymphomas, widespread metastasis. When you think of leukemia and lymphoma, of course, it's all over the blood. So that's why they say it's disseminated. It can go anywhere where the blood goes. Drugs are also used in addition to surgery and radiation to kill malignant cells that surgery and radiation may have left behind. So it's kind of like an insurance policy. Even if an area gets radiated and we go in surgically and try to remove the cancer or the tumor, they will follow with a chemotherapy regimen. So now we have to talk about kind of the meat of this lecture is the cell growth cycle phases. And GO is a resting phase where the cells are just not doing much. They're just kind of resting there. We're not too preoccupied with those. G1 is the pre-mitotic phase, and we know what mitosis is, or cell division. Is cells prepare to synthesize the DNA. S cells is where it does synthesize the DNA. And that's where a lot of the chemotherapy works, is right in there, in that we try to get it in that G1 and S phase. G2 is where the cells prepare for mitosis or division, and M is where the cells actually divide. So upon completing mitosis, the resulting daughter cells have 2 options. They either enter G1 and repeat the cycle, or they can enter the phase known as GO, where they become mitotically dormant. They do not replicate, and they're not active in that cycle. Cells can remain in that GO or resting stage for days, weeks, or even years. And without leaving this area, let's talk about the growth fraction. The growth fraction of a tissue refers to the ratio of proliferating cells to cells in the GO or the resting phase. Tissues with large percentage of proliferating cells, meaning they're replicating, and few cells in the GO have a very high growth fraction rate. Doesn't that make sense? Because they're replicating, they're not resting. Conversely, tissues composed of mostly GO cells have a low growth fraction rate. So you need to understand these cycles so that when we're talking about a drug that's in the G1 and S phase, it's trying to get the cell prior to it replicating. If we're talking about the M phase, we need to really have a cytotoxic type drug, because it's already reproduced or reproducing. We need to kill that before it moves somewhere. Okay, cytotoxic and anti-cancer drugs, which is one of the very first groups we'll look. They're more toxic to cancers and have a high growth fraction rate, obviously, because we're in for the cell kill, than cancers that have a low growth fraction rate. Why? Because cytotoxic anti-cancer drugs are more active against proliferating cells than against cells in the GO or resting phase. Proliferating cells are especially sensitive to chemotherapy because cytotoxic drugs act by disrupting either the DNA synthesis or mitosis. Unfortunately, toxicity of anti-cancer drugs is not just restricted to cancer cells. It's also toxic to normal tissues that have a high growth fraction. And so we know, because it's always proliferating for us, our bone marrow with our red cells and our white cells, it attacks that. Our GI epithelium in the gut is continually moving. Hair follicles, it's just daily where your hair is changed over and over, falls out and becomes new. And then also sperm forming cells. So because of this, they're especially the cytotoxic drugs are more toxic to tissues that have a high growth fraction than to tissues that have a low growth fraction. Because of this, with the sperm forming cells, men that have all kinds of testicular, even prostate, and they're of childbearing years, they basically tell them to bank their sperm prior to getting chemotherapy, or they may not be able to have children. Cytotoxic anti-cancer drugs injure normal tissue because they're injuring normal cells. Because they have a lack of selective toxicity, I mean, they're not selective. They haven't been able to do that yet. Make it just so that, like, it's kind of like with antibiotics, can be very selective. Not the broad spectrum ones. They may kill a bunch of different bacteria, but for instance, penicillin, we know is for gram positive. We know it does well with staph and strep unless it's MRSA. Chemotherapy is not like that. We haven't been able to make it that selective because at the cellular level. Bone marrow suppression may become, with bone marrow suppression, they can become severely anemic, lack of red cells, with GI, nausea and vomiting, just severe from these drugs. And hair follicles, they suffer from what we call alopecia, or loss of hair. And then again, sperm forming, we're going to have them bank the sperm. So I'm going to stop here because I think my time's almost out, and we will move on with the next part of this presentation. Okay?